Every year we do a festival of learning. LOC stands for Learning Organisations Collaborative, and we bring all the organisations, not just across Cumbria but across the north of England, together. We're sponsored by our Academic Health Science Network, and today we're looking at human factors and safety. We've had a long tradition in North Cumbria at trying to learn from other industries, and that's what human factors in many respects has been about in terms of its history through into healthcare. The real question is, how do we as staff interact with patients and the equipment we use and the systems we use and the processes we use to make everything as safe as possible. We've got a mixture of speakers today, really looking at practical experience that people have had, ways in which we can build safer systems, either in terms of design of equipment, design of spaces, training of people, self-awareness. There's a huge range covered by human factors, but we've also made sure we've got speakers coming in from other industries. So we have a trainer from the railway industry, for example. We've got somebody coming from the Royal Academy of Arts looking at design principles. It's a real mixture of looking at the way we as people interact with the systems we run, with the equipment that we have, with the tasks that we do, to make them as reliable, reproducible and as safe as possible.
This has been part of a personal journey as well as now I think a journey for the organisation. Having got the reintroduction of human factors training within the trust done by our own CLIC staff a year ago, I think this is an amazing turnout for a conference that is purely dedicated to human factors, and with 10 workshops, guest speakers, and actually fundamentally when I gave my talk about my journey in anaesthesia intensive care was to hear Andy from the rail industry sit down after he'd given his talk and say, well, there's so many parallels between our industry and safety. Fundamentally, I think this is something we really need to focus on over the next year to 5 years to give us the improvements in safety we must deliver as a system.
In a nutshell, it's about how you connect the more thinking brain with the more emotional brain, because when people are stressed, the problem is people default to the very old emotional brain, which is about running away from danger, it's about getting yourself into situations of greater safety, but very often will mug you, knock out the thinking brain, your ability to make sensible decisions, and as a result you often get yourself into all sorts of trouble. And within this environment we're teaching a very specific method called the Wiser Mind model, which is a method that teaches people how to get the thinking brain and the feeling brain to actually work together. And as they work together, it generates something that we call the Wiser Mind. And that Wiser Mind, a better state to work with everything you have within yourself and to connect better to the world, to make better decisions, and to, in many, many ways, manage the normal stresses and difficulties of everyday life. The key takeaway is that it's a very key technique. It's a formal technique which it's a 10-minute process, and once somebody's actually learned to do this, they can take that forward and just use that in daily life. Immensely practical, incredibly straightforward, and fantastically evidence-based in terms of modern psychological theory and neuroscience. It's a real winner.
Been looking at human factors and what it feels like to juggle lots of conflicting demands and what impact it has on us as human beings, as well as the wider system and patient safety. So we had them in different groups. So we had a blue organisation, we had a yellow organisation, and we had a red organisation. So we were looking at how do we work as teams within our organisations, but what would happen then if we brought all our organisations together? How would we develop that good communication and trust and teamwork across a complex system? I thoroughly enjoyed myself. I enjoyed watching people throw balls at each other and having a good laugh, but also doing a lot of thinking and reflecting and learning at the same time.
I'll be talking about the way in which we work, that is getting designers out of the studio and speaking with people at the front line of healthcare, as well as patients, as well as procurement staff and regulatory staff, to try to develop new products, processes, services and so on to make healthcare cheaper, more effective and safer. The key thing I'd like people to take away is for people at the front line of healthcare to be aware of how things are designed, to point out problems and to not accept bad design in the course of their work, and therefore lead to new and exciting innovations. I think we always need to be looking at how things could be done better and putting the right sort of teams together to make those sort of changes that we need.
We launched Melissa on behalf of the region really. We knew there was a need to ensure equitable access to training and education. Junior doctors, trainees all come to the big SIM sites, but we know that we've got a mass rural area and hard to reach places. So what we wanted to do was have a facility that would take training out to them rather than spend money on travel, accommodation and time getting people to a central area. Why not take training out to the community? So we've invested in Melissa, essentially a simulation and training bus. We've set her up as a simulation clinical suite at the moment. Upper deck, we've got a control room. Downstairs, we've got a debriefing area. All of the camera and AV equipment go downstairs and stream to the monitors that we have downstairs. But essentially, she packs up. So once this goes away, this is a really flexible and adaptable space. It doesn't have to be simulation. It can be any kind of training and education that we want to take out to the region. Not just NHS staff either. We're looking at social care, charitable sector, anybody that's involved in delivering care to our regional health population. We're all very, very important in making sure that our population stays healthy, so we need a level of skill training to everybody, and that's exactly what Melissa's intended to do.
I'm Emeritus Professor of, well, it's a mixture, and that represents my career over the years, really. I teach communication skills to doctors, I teach management to doctors, and I'm involved in leadership and patient safety as well. For me, human factors underpin my career. From a simplistic point of view, I'm looking at patient safety and using human factors to improve that, but I'm also looking at cultural conditions in organisations, which I term medical engagement, and it's the way in which medical staff are involved, participate in the running of their organisation, which in itself circles round to influence patient safety by their contribution to that. I hope they take away that there is a new thinking around patient safety that is proactive and is oriented towards risk. I hope they understand too that medical leadership in itself is not the solution to many of the organisational problems, but the creation by medical leaders of a culture of medical engagement probably is. And they would be my two strap lines to take away.
I'm the Managing Director of a railway safety training company. If you want to work on the railway, you have to have like a passport which sits on a national database, records your hours and your competencies, and we're one of 100 companies that offer this service right across the country. I was bringing a perspective from a different industry. I'm professional in the rail industry. The rail is a very heavily regulated and obviously quite a dangerous area, and I introduced two different areas, one to do with operation of trains and how we've got very much better at preventing train crashes, and then the human factors for the guys actually working on the track. These guys out on the track 24/7, undertaking maintenance work and renewals work, and it's how to keep those safe amid the mix of an ever-increasing amount of railway traffic that's present. It's the transferability, it's about the planning, it's about the communication of the plan, it's about making sure the distractions don't take away from the focus. It's about, just-in-time resourcing, lack of resources affecting the way you work. There's a lot of transferability.
We've had a fantastic day. We've pulled together all sorts of different thinking from the way an A&E department is designed and how it looks in terms of safety for patients and staff from aggression and violence, through a real close academic look in some of the workshops, everything from communication to how we control ourselves. We've heard from other industries, like the railways, and how they measure near misses as a really important way of looking at how they can change their culture, how they can change the fact that accidents still do happen when they shouldn't. Altogether, we've seen how big human factors is and how important it is, and how we need to share, both with patients and with communities, the way of making things better.